Good afternoon, everyone. Welcome to our first Virtual CPD Summer School. It's fantastic to have so many of you with us on this sunny afternoon. My name's Charlotte Stevenson and I'm a Business Development Manager in the Cardiff University. Just two quick bits of housekeeping before we get going with today's presentation. We've got the chat function available there if you need to talk to the team. There's a few of us on hand if you've got any sound problems or anything like that. We've also got the Q&A section. If you want to ask Deb and Sarah anything, just type it in the Q&A and we can come to that when that's applicable. Please bear with us. We're all working from home, so if there's any technical issues, comedy talking while on mute, or interruptions from animals, children, or delivery people. That's enough from me. I'll hand you over to Deb and Sarah to get going. Enjoy.
Okay, I hope everybody can hear me. Thank you so much for joining us for this event today. Just a quick introductions before we get started. My name is Deb Hearle. I'm the Head of Health Professions here at Cardiff University and one of the co-founders of the TRAMm model, which we'll explain to you later on. My technical skills are probably pretty poor, so please, I accept my apologies if there's any glitches as we go along, but I do have my colleague Sarah, who I'm just going to hand over to introduce herself.
Hi, my name's Sarah Lawson. I'm an occupational therapist and PhD student at Glyndŵr University in Wrexham, and I'm work with Deb co-developing the TRAMm model. And I'm on backup today, so I will be trying to manage the chat to answer any questions you might have, any comments you might want to make, or anything that you want to find out more about. I'll be manning the chat box.
Okay, thanks, Sarah. So just a little bit about what we plan to do today. The first thing is, one of the things, particularly with COVID at the moment, we're having to really think about how to change our mindset about CPD and what it is and how we can look differently at it. So we're going to start off by taking you back to what we think CPD is and what it means to be engaged in CPD. And I hope you'll bear with us on this, and hopefully you'll pick up some things that perhaps you haven't thought about before. We're going to give you some ideas about how you might actually change your mindset about the nature and opportunities of CPD. And we're also going to provide you with a brief overview of the TRAMm model, which, as Sarah said, this is where we have become involved in being really interested in CPD. We've developed a model which hopefully gives you some thoughts about how you might engage in CPD and what it really means if you're really engaging in CPD. So we'll tell you a little bit about that later on. As Sarah also said, what's going to happen today is that I'm going to be doing most of the presentation. Sarah is going to be managing the chat bar, but she may come in on things if there's anything that she wants to add or any feedback she wants to give me from the questions or the points that you're raising. So if we have a look at CPD and what it's for, first of all, if you key in the definitions of CPD, there's thousands and thousands of definitions. But really there are three core things coming from it. So one of them is about maintaining competence. And so White's definition there might be something that encapsulates that, or we think encapsulates that. One of the next things is about safe practice. But I think overall, the reason we do CPD is that we can protect the people we serve so that they can trust us to provide the service they need. Now, I think just to give a bit of background, Sarah and I are occupational therapists. We're both from a health background, and we designed the model and the work that we will be presenting to you today with healthcare in mind. That said, we've worked with people such as teachers, people in business, and law, that sort of thing. So actually it does cross over into such a variety of areas. And, you know, if we take law, for example, that ideally the reason you do your CPD and the reason that you grow and develop and keep looking up and go on courses and develop, read articles, that sort of thing, is so that you can protect the people that you serve, just as the same that Sarah and I do as occupational therapists. So some of the reasons linking to that idea of quality are that we want to achieve and drive high quality practice. So there is evidence to show that those people who fully engage in CPD, their quality of practice develops and grows accordingly. We look to increase our job satisfaction and reduce burnout. And again, there is very strong evidence to show that those people who are supported to engage in CPD and do so, and then supported to apply the information or the CPD, the learning they've undertaken, they do feel more satisfied in their job, and it does reduce burnout for them. And then the other thing is to carry out up-to-date evidence-based and informed practice, because the more we're up to date with our evidence around what works, what doesn't work, then the more likely we are to be able to practice to the best of our ability. And in order to achieve this, we strongly push that people should be fully engaged in CPD. And it's not just a case of doing it or undertaking CPD, i.e. the old impression that you go on a course, get a few points, put them in your file, and then go on and carry on with the work that you've been doing in the past. There is a process, there are criteria that actually show that you're really engaged in the CPD process. And we often get asked, Sarah and I both work in education, and we often get asked by students, you know, what is the difference between CPD and our whole course? And what we say is that it's the significant parts of learning that you really engage in, that drive you and move you forward to work in a different way perhaps, or to justify the work that you do, rather than just everything that you learn. Told you. Okay, so why do we need to change our mindset and approach to CPD? We've already talked about the COVID crisis. There's no point in me avoiding this. And I think it has made people start thinking quite difficulty. We've had quite often people say, I can't do CPD at the moment, I haven't got time, I'm too busy with adjusting things for COVID. But actually what we would like to encourage you to think about is it's about making the most of potential opportunities. It's about acknowledging the many areas where you're learning and developing at the moment. We have funding challenges, we know, due to COVID, but that doesn't mean we can't and we're not engaging in CPD. And it also enables us to balance our workload as well. But in addition, in particular since COVID, we have this need for social distancing. So it's very difficult to go on what people traditionally think as CPD, go on a course or a conference, because of the need for social distancing and the lack of people being able to travel and move around. We can't do that sort of thing. And also, in addition to COVID, as I say, people are changing, they're upskilling in a way, in a speed that's never been done before. And it's in the COVID situation is enforcing changing working practices. And what I want people to do is to start thinking, actually, these are our CPD opportunities. And we can make the most and think about how are they helping us to grow and develop. The next part of the presentation is looking at what CPD is, or how what it means to be engaged in CPD. So if I take the TRAMm model to begin with, and I say I'm not going to be going into detail of that, we have put at the bottom of the screen and on the presentation, there is a link to our website. And this isn't a sales promotion or anything. Everything that you can gain from the website is actually free of charge to download, to look at, to read. There's opportunities for you to engage with us as a team, but none of it involves a cost or anything. So it's just to let you know that there's more information if you wish to find it. But what we looked at when we started to look at CPD as a group a long time ago was that there's really no understanding of what it means. And so we looked at the literature, we looked at the information that was about people's understanding, and we found out that what we believed and what we were reading was that actually it's a personal and mandatory journey to fully engage. So yes, for most of us who are professional healthcare professionals or professionals in other walks of life, such as business, law, education, engineering, any of those areas, part of it is about what we want to do and develop. But for some of us, we also have to show that we are engaging in it. And what we came up with are 5 areas that we think, if you're paying attention to these areas, then it does give you an indication that you're really engaging in CPD. So the first thing is about telling people. Now, telling we split into 2 areas. One of them is about the planning. So it may be that you discuss your learning needs with your supervisor, with your line manager, with others in work. You get information from them about what's available. Somehow you found out about the course today. But the other part is the dissemination of what you learn. So there is a requirement that if you undertake and you're engaging in CPD and you learn something from it and that learning is useful, then very often it's useful for other people as well. So it's important that you share that information and you don't just keep it to yourself. It's good for your profession, it's good for your own personal development as well. Record is quite straightforward, but what we often encourage students to do, and also practitioners that we talk to, is have a think about why you're recording it, and not just record it for recording's sake. Obviously, if you are having to undertake mandatory CPD, there is a requirement to record. But also there are some really good reasons and some other things that recording it might help with. So for example, if you're recording your CPD through a reflection, some of our practitioners say, well, what's the point of doing recording a reflection if nobody sees it? But what we say is that actually the recording of it in itself helps you to really look at the situation and look at where your learning has come from and perhaps where your learning needs to go from here. So it's about a process of learning rather than just a mechanism to jot stuff down that you've done. Applying the information, we're going to talk a bit later on about the importance of how to apply the information that you're learning. But also thinking about what you have to think about before you apply things that you learn, particularly new learning. And then the other two areas of the TRAMm model are that at some point you need to be monitoring your progress and thinking about how you have got from A to how you're going in relation to what your aims are of the CPD. That might be supervision, mentorship, or even reflections, or just talking to other people, but also measuring the impact of your CPD. And certainly as health professionals, that's one of the things that we have to do, is we have to show not only that we've engaged in CPD or done something, that we've applied it and that we've also measured the impact of what we've done. And I'm sure that applies to lots of other areas rather than just health. So the TRAMm model itself is a dynamic interactive model to facilitate a strategic approach. We've designed it, as I said, with healthcare professionals in mind, but actually the model itself sits outside health. So it doesn't have to be related to health at all. It does help, and we've had lots of people say to us, it's helped frame our thinking about what CPD really is. So as I say, although we have done it for healthcare professionals, within the TRAMm model itself, we have three aspects at the moment. So we have the whole thing is called Tram CPD. So when you go online, if you go and have a look further online, you will find it says Tram CPD. And what that refers to is the model that I've just spoken to you about. But there are also some recording tools there. Now the Tram Tracker is a recording tool that basically will just allow you to record episodes of CPD. Okay, so there's no detail on there, but it might give a date of something that you've done, a brief detail of what you have done, and then it will give you some smaller areas to be able to tick and say that you've got certificates for it. It'll match it to the TRAMm model to say that you've addressed tell, record, apply, monitor and measure. There are also 5 boxes on there which are about the HCPC standards, but you can feel free to ignore them and just use the boxes for yourself. So that's the only bit really that relates to the allied health professions. The TRAMm Trail just provides a bit more detail about the significant pieces of learning in CPD. So it gives you an opportunity, if you don't have time to go away and write about it straight away or record it, that it gives you an idea about the sorts of things that you might be able to, that you've done in relation to this particular area of CPD. So all those things are called TRAMM CPD. And as I say, you can get more information. The other thing that Sarah and I have done as part of our research, mine as part of my professional doctorate, and Sarah has also been doing work with me alongside this as part of her PhD, was having a look at what do we really mean by CPD engagement. And from a concept analysis that I took as part of my prof doc, I came up with 5 defining attributes of CPD engagement. And as we go along, if you want to note anything about your thoughts about this, you're very welcome to put these in the chat bar. We're always interested in people's comments about this. So the first one is often a little contentious. But that what we have said is that CPD is self-initiated and undertaken voluntarily, rather than as a result of a mandatory requirement. Now, the reason that we've built this in is because wherever we looked in the literature, whenever we talked to people, the things that they highlighted was, yes, we have to do it, but actually those things that they do are self-initiated and they do undertake them voluntarily. So although the process of undertaking CPD might be mandatory, those aspects they choose. So people go into specialist areas that they choose to go in. If we're looking at education, some will go into primary education, some will go into secondary school, some will go into management, some will go into inspection. There's all sorts of different ranges that people will go into, but their CPD often takes them in that direction, and it's been a thing that they've actually initiated themselves. Another thing that really categorises if you're truly engaging in CPD is that as yourself you feel rewarded, and that might be intrinsically, so actually you really enjoy what you're doing and you get this flow, as we talk about, that you just really want to do it and you want to read more and you want to perhaps on a course about it, and then you want to talk to others about it, and you perhaps read your journal articles and etc., because you really enjoy it and it's an area you feel passionate about. Or it may be there is an extrinsic reward, so that might be promotion, increased salary, that sort of thing. But either way, there is some sort of reward for if you're engaging in CPD. The knowledge or skills that you gain via CPD are embraced and applied in practice for the benefit of the service or the service user. So that this goes back to the bit we were talking about with the TRAMm model, that actually it's no good just doing something or developing your knowledge and skills in an area but not doing anything with it. It's really important. We talk about services and service users within healthcare, but it could be, you know, from my perspective, working in a university, my service user is a student. So everything I do very often is either for the benefit of the student, or it could be for the benefit of the organisation, or for the staff who work in that organisation. So as I say, it doesn't have to just be patients. We've talked about learning being recorded, evaluated and shared with others. That came out when we talked about TRAMm as well. But finally, very often you find if you're really engaged in CPD, it is evidence to continue beyond the initial CPD activity. So it's not just a one-off thing that you do, it's something that you take forward. So for example, let's say you're attending this session today. Some of you will have attended the session and thought, that's great, thank you very much, and ticked it off and not think about it for now. Some of you may go away and actually think, yeah, I need to think more carefully about how I engage and embrace CPD. I need to think about being a bit more strategic about what I do, or I need to share what I do a little bit more. So already you're taking some of the messages away. You might actually go and and jump onto the website and have a look. Or you may come back and actually look at more of the opportunities that are offered by the CPD unit here in Cardiff University, for example, because you've started to apply some of the information we've talked about today. But it's something that when you are learning, it does continue beyond that initial, just that initial contact that you might have. So as I say, those are some of the things that we came up with from the literature, but if it's something, if you have any comments about any of these things, feel free to impart them in the chat box. What we wanted to do now is just to give you a bit of an illustration about this. So how somebody might be truly engaging in CPD rather than just doing a CPD activity. So we've got Susan here as a case study. She's a Band 8 lead occupational therapist, and she's been asked to design a proposal for how her team can support the management of COVID-19. A nice easy task for her. So if you just have a look now, if you want to read at your own pace the case study, I think it's probably makes more sense than if I read it out to you. I'm going to move it on in just a minute. Okay, you'll get to see it again in a second if you haven't finished the last few bits. But the following slide, what we've done is highlighted the stages of the TRAMm model within that scenario to show that actually Susan is truly engaging in CPD. So if you think about the things that we've talked about, the telling, so that's the planning and dissemination of CPD, the recording of it, the application of what she's done, the monitoring and the measuring of it. So if we have a look, if we take the first thing, which is the telling, okay, that's in red. So some of the things I've highlighted in the red font are things where Susan has actually either used some form of communication to express what she's learned, to disseminate what she's learned, or ways that she's used to actually talk through some of her interests in the area and help to support her her planning, her development. If we take the green, that's about the recording of information. So after the meeting, Susan makes detailed notes. There's a few other bits later on that we could argue are also recording. In regards of applying, this is where she has designed a guidance document. So she's actually starting to apply some of the knowledge that she's learned now. And she's, within this guidance document, she's also prepared a training session which talks about her plans for service delivery. So not only has she investigated the area and talked to people and recorded it, but she's actually starting to apply this now. And then if we have a look at measure, which is the orange font, the small pilot study that she has done to measure the impact of her new rehabilitation programme that she's done. Now, she's not implemented it yet, but what she has done is started to plan it and decide how she's going to evaluate and measure the success of it. And then in terms of monitoring, she then talks about this with her line manager and sets new goals to achieve in relation to the project over the forthcoming months. So you can see here this bit that was in our fifth measure of engagement, was that she's actually done something more than just the initial activity that she started with. She's taking that forward and it's actually becoming part of her role. Right, the next thing that we want to talk about is the changing your mindset about the activities that may contribute to CPD. Now, we all know about the traditional courses, study days, conferences, those sorts of things. That's often what we automatically think of. I mean, a new innovative thing is the Virtual Summer School, which was definitely, the idea was new to Sarah and I when we started thinking about whether we could contribute to this or not. So we just want you to have a think, and Sarah's going to, again, look at the chat box, but we just want you to have a think about some of the courses and training activities, or beyond courses and training activities, sorry. What sort of things are you engaging in at the moment to help you learn and develop? So if you can have a think, and if you want to type any examples into the chat bar, then looks like Sarah's typing. You're on mute, Sarah.
Can you hear me now?
I can hear you now, yeah.
Yes. So we've got people that are attending webinars, reading articles, working collaboratively with colleagues and students to develop a resource for giving and receiving feedback. Internal CPD on delivering lessons virtually. There's lots of people been learning how to move their teaching online.
Excuse me, that's me.
Podcasts, webinar, MOOCs, you know, the massive online.
Oh yeah, yeah.
I can't remember what.
Yeah.
But it's the free online learning courses. Oh, participating in volunteering events.
Fantastic.
So there's a big range. Learning new technical skills, new PowerPoints and how to do posters.
So there's lots of things there that actually don't involve money, don't involve searching for funding, don't involve you travelling at all or going anywhere. Whereas, as I say, at one time we may just have thought that going on a course was the only way that we could achieve our CPD. Certainly the volunteering activities is something we encourage with our student groups, and it's something they'll start at the beginning of the course and they'll continue with during their progress of their degree. I guess what we've probably done, we've already picked up on some of the ideas about what day-to-day opportunities are currently available, but the sorts of things with regard to that, there may be things that it's something that you're doing, and we're going to talk in a few minutes about how do you know when your day-to-day activity just becomes CPD. But some of the day-to-day opportunities might be the best CPD triggers that you have, and may start you off on this journey. And a couple of you mentioned from Sarah giving the information that learning how to do online seminars or webinars or discussion, classroom teaching sessions and that sort of thing. I mean, for somebody like myself, that is massive because my technical ability, as you've probably seen already, is not brilliant. So me doing a webinar 3 months ago would have been out of the question completely. Sarah will agree with that, I'm sure. So actually, I've not been on a course. I've just learned from working with colleagues, like again somebody said. But actually, this has been a massive CPD opportunity for me, and I'm quite enjoying doing it now, which means come September, hopefully I'll be experimenting with different platforms, different learning tools and things to help my students develop. Whereas pre-COVID, I wouldn't have dreamt of doing that. I'm sure there are lots of day-to-day opportunities that are currently available. And then the other question for you to think about was, how do you know when you've learnt something is CPD and it needs to be recorded? So I don't know if anybody has any ideas about that. How do you know when you've actually done something that actually is CPD? What are the things that when you're learning something you think, actually this is really important in my career, this is really important, it's going to have massive implications in what I do? Okay. Okay, I'll move on from those things. So it's just to start getting you thinking. Can I have an idea of the time? My mobile phone has just crashed on me. I told you technology was a problem.
It's 25 to 3.
Okay, thanks, Sarah. Okay, so thinking then, what we want you to go away and think about is, besides courses and conferences, what other things could you pursue that would lead to your own professional development? And I'm not going to ask that question of you now. It's just something that I want you to go away and have a think about. And if you hadn't thought about this angle before, then it might be a useful reflection for you to do. So one of the things that we said that we would have a look at is, how do you know when you're learning something which could be CPD? So this is not an exhaustive list by any means. I'm going to try and move this out of the way a little bit. But what we were thinking was that some of the things that people have come up with in the past is that perhaps they've stopped working on automatic pilot. So very often within our careers and professions, there are things we are comfortable with. There are things that become the core part of our profession that actually we can do. I'm not saying we don't think about them, but we do, and we can manage without any challenges. But occasionally there's something that makes us stop and think, how are we going to address this situation? This is what we call the stopping working on automatic pilot. It may be that at some point you've had to look something up or ask others for advice. You might have actually identified, implemented a new way of working. So sometimes when we talk to people, they'll say things like, well, I haven't done CPD for ages. But then when we talk to them, they've actually implemented a whole new assessment system within their department, or they've implemented a whole new way of working within that team. But they haven't seen that as continuing professional development because they've thought of it as part of their job, but actually it's something that's made them stop, think, look into things and develop something. Occasionally people might have undertaken an intervention. Now in health we call interventions treatments, or something we do to in terms of rehabilitation, or something we do to enable people to progress with their treatment. But we can look at that much broader across different professions. But that intervention might have had some unintended consequences, so something you weren't expecting to happen. And that's made you stop and think and investigate why that might be. That itself could be considered as a CPD opportunity. So one of the things I remember was working with a patient at home, and I set up a community program for people who'd had strokes. Now, actually, the setting up the program was one CPD opportunity because I had a lot of investigation to do. But once I evaluated it, I found out that actually that although it was rated really highly, it was the fact that people had somebody had always gone in to see that person in the community, and they hadn't been felt isolated or left alone. And actually, that didn't have to be me as an occupational therapist. So what we then looked at was the importance of having a troubleshooter that was going out to see people in the community. And that started to develop some new practices within different teams. If we think about, are you developing advanced skills to further your career? I think most of you would probably see that as CPD. But are you employing an activity to learn something new? Again, something that you might not always have thought about. Have you been asked to undertake something new for which you've got little or no experience? If we go back to Susan, the case study, she was asked to manage, to design a proposal to manage COVID CD within the service. That definitely was new to her, but you could see the triggers of different CPD opportunities that gave her. Obviously, are you using the knowledge gained from a training activity to improve your practice of service user outcome? Or has something just caused you to stop and reflect? Or caused you to feel a bit of discomfort somewhere that you think, oh, I don't feel very happy about that. Or it's caused you to just stop and think and really reflect on what has happened in that given situation. It can be a very positive situation, or it could be something that's not gone as well as perhaps it could have done. But all these sort of things could be the start of you engaging in CPD. And then we want to think about how you currently approach your learning. And in terms of applying that work that you do. So how do you know if it's appropriate to apply new knowledge and skills in practice? So we've already said that it's really important to apply knowledge. You can start thinking about how you apply this knowledge, but we also sometimes have to take a step back and decide, okay, how do we know that it's appropriate, particularly if you come to some new seminars, and then somebody presents this very new approach to working with somebody. And so what we often get people to do is think about, okay, take that step back. What do you need to do before you jump in and try and have a go at something that you learned? So the first thing might be that you know it's from a credible source. So the course you went on or the journal article you read is perhaps in a credible journal, or it's written by somebody who you know is really top in your profession of some kind. Doesn't mean it's the only way that you can apply information or look to apply information, but you want to check first of all whether it's from a credible source. If it's something you read on Wikipedia or something, it might not be the best place to start. So what you might want to do is go further and carry out some background research and reading into the subject area. So what does the evidence say? We get lots of people presenting things that their new ideas, their new thoughts around different things. But okay, you've got their vision of it. But now what does the evidence say? So you might want to carry out some background reading and research. It would be useful to practice the new skills while learning is fresh in your mind, but make sure, do you need permission from others to do it? Or do you need further specialist training? So if you just go and read an article on a particular technique, does that mean that gives you the skills to do it? Or is there something else that you might need to do? And it might be useful to help to work alongside someone else that you consider to be an expert prior to applying your new skills or on your own. And the other question we often ask is, will it be sustainable? So is it something that actually can be embraced by other people, can be embraced by the department, might be able to move forward? I'm just trying to think of an example. We were looking into peer feedback, and we've got a project going at the moment looking at peer and constructive feedback. We were looking at it initially in relation to occupational therapy students, but we were being asked, how sustainable can that be as a guidance and a information? We're looking at designing an online service. So what we've started doing is actually thinking about it broader to make it more usable for other people, and that it's something that isn't just designed now and can't be changed or can't be developed. It's in a platform that will be allowed to allow people to change things, to move things, to add information, to take information off. So it's a sustainable CPD opportunity. Just another quick way to think, if you're in work and rather than thinking what CPD shall I do, there are 5 questions that you might want to ask yourself. So one of them, the first one, what have I done? How does what I've done update my skills and knowledge? You might get to that point and think actually it hasn't, so there's no point in me continuing with that. I'll have a look at other areas. How has this benefited or changed my work? What have I done differently? So this is your application bit. And how has it benefited the service delivery or the service user, client, patient, customer, whoever you're working with? So this is sort of looking at the impact then on others. And then going back to the original questions of what CPD is for, how does it relate to my ability to work safely, effectively and legally? So again, some quick fire questions. You might just do that in relation to your own working day. What have I done today? And then slowly but surely you actually pick up, actually, this is something that might have contributed to my CPD. Just drawing this really towards an end, thinking about changing our mindset about the way we access CPD. So I know there is a lot about, even in our institution, very often it's about, okay, we've got to apply for study leave, we've got to apply for money to go on whatever event it is. But actually, we've already looked earlier, and with lots of your ideas, there were things that you've suggested that you were able to do that didn't cost money, and things that have enabled you to grow and develop. So really just some final thoughts from this is that it's really important to be proactive. So don't wait for someone else to do something. You know, now with COVID, there are lots of things that we're having to develop and grow. So don't wait for yourself to read it in some article or hear about it on a webinar. If it's something that you think, actually, this is something I've developed, I've started doing, actually it might be worth sharing with others, do so. I think it's really important. I know for some that's putting yourself out there, but it doesn't mean you're putting yourself out there as an expert. One of the things Sarah and I have done with TRAMm all the way along is asked people to critique what we've been doing. We've actually helped the model and our thinking to grow and develop actually by doing that sort of thing. So although it's sometimes hard to put yourself and think, oh, what people are going to come up with, it's really useful information that you can really help change your thinking over. The next point is think creatively. So if there's no money available, how can you achieve your goal without? So that might be looking at all the other opportunities. I know within Sarah's research, a lot of the information is for CPD has been about communities of practice, the actual communication aspects of working with other people in similar situations. And so it may well be that there are opportunities for you to think creatively about how you actually achieve your CPD without having to put forward for money. But if you do need money, how could you resource it? Or what might people gain as a result of you doing it? So this is going back to think about, okay, the impact of what I'm doing, the impact of what I'm learning. We've been looking at updating the book that we've written. And one of the things that we've done in that is put an idea of a business case about the sorts of things that you might want to think about if you are putting in for money for CPD. What sort of things you might be able to give back to the areas that might provide you with money to enable this. So or how you might go about doing it without money at all. So sometimes it's if you think creatively, you may be able to get around this. I haven't got the time, I haven't got the money. We always encourage people to think others. So who else might be able to help in this situation? Where might I get this information from? Who has the skills and knowledge that might be able to help me? And what? So it's a bit like the traditional bartering system. I can help people in this way, and if these people can help me in that way, we can all grow and develop together, but in different other things that are important to us. And then finally, think opportunities. So what is important to my organisation? How can I tap into these areas? Or what is actually going on in my organisation, or what is going on in my profession? So I know a lot of you have already done that today by tapping into the CPD Virtual Summer School, because this is an opportunity that's available and something that you can dip in and out and try and find different things that you're doing that might be useful to you in the future. So it's about, as I say, thinking opportunities and what things might I be able to get support for to move forward because they're important to other people and rather than just myself. It doesn't mean you can't think about your own development opportunities, but sometimes these things, so again, going back to Susan, what was important to her organisation was them having this system that would enable the occupational therapists to manage COVID within their sphere of professional practice. So therefore, that was something that she tapped into and used as her trigger for CPD. Okay, so that brings the presentation to an end. I know Sarah is happy to take any questions that you might have. I can't see the chat bar, but I can find it somewhere. But as I say, from my perspective, that's it from the presentation. Sarah, have you got anything you want to add?
Only we've had a question about the Cardiff, I forget what it was called, the Cardiff Award. Do you know anything about that?
Yeah. Yes and no.
And just the question, would CPD such as this count?
Right. What I think the Cardiff Award is the way that the students can use to build up their CPD. And I don't know whether Jess and team and Charlotte may know a little bit more about this. Usually there is somebody within your programme who is either leading on it or can point you in the right direction of how to enrol. So some of our students, for example, are enrolled on the Cardiff Award, and there are certain things that they have to do and have to achieve in order to get there. I'm not sure whether this would actually count towards the Cardiff Award, but actually it will help you to think, and you may use this as one of the things that you've done to enable you to think about CPD, and something that has enabled you to change how you think about CPD, that you can then do things that will give you credits for your Cardiff Award. So Jess and Charlotte, I don't know if you know anything more about this.
I think, sorry Jess, you go.
I was going to say, I don't know in relation to the Virtual CPD Summer School specifically, but it's certainly something that we can go away and have a chat with Claire Sinclair about and explore a little bit further. So I'll make a note of the question and the person who posed it, and then I can get back to them via email, if that's helpful.
Lovely. The other thing is Nina Cogger, who is she's the contact in occupational therapy for the Cardiff Award. So she might be a person you want to have a chat to, because she's the one who matches students up with this within occupational therapy. So.
Lovely. And there aren't really, I've not had any other questions particularly that, how do we get proof that we attended summer school?
Oh, to you, Jess and Charlotte.
So the summer school is not accredited in any way, so we won't be issuing any sort of certificates or anything like that. But we've been told, particularly from, I think it's some of the architecture sessions that we've run earlier this week, that often it's just enough to kind of note down the session, when it took place, how long it was, and you know, again, please feel free to drop me a line via email. If I can sort of provide any sort of email response to confirm your attendance, then I'm more than happy to do so.
The other thing that you might do is, if we think about going back to this changing your mindset about CPD, what it is and how you record it, evidence can be lots of different things. So actually, if you sat down and did a reflection on perhaps some of the core learning that you have, you might detail that I attended all these sessions, but that you might then, and put the time or date, but then you might reflect on one of them in particular that you think actually is going to have quite a significant impact on the way you think about things, or the way you might go and apply these in your workplace. And that reflection in itself is evidence. So don't think you've got to get it necessarily signed by somebody else or proof. It might be that your reflection includes how it's changing your practice and what are other things that you've gone on to develop to enable you to apply this knowledge. So I'm not sure how that works for every profession, but I know, for example, within the allied health professions, HCPC don't need a signed piece of paper from everybody to say you've done this. What they look for is how you've used it and how you've applied it and the impact it might have had, and then to them that's the evidence that you've actually done something.
We've also got a question about, can they get copies of the slides?
Yeah, so we'll be issuing the recordings for all the sessions at the end of the summer school programme.
Lovely, thanks Jessica.
No problem.
Okay.
Great. Is that all the questions answered, Sarah? Brilliant.
Yes.
Okay, thank you. Just to round up then, I just want to thank everybody who attended the session today. It was a really interactive session, so that was great to see. And again, thank you to Deb and Sarah today for another great session. We hope you all enjoyed it and enjoy the rest of the day. Take care.
Thank you.
Thank you. Bye.
Bye.